U.S. Customs and Border Protection reports 64% of methamphetamine entering into the U.S. last year was seized at the San Ysidro, Otay Mesa, and Tecate ports of entry. That works out to 14,732 pounds of meth seized at those ports alone. Here with more on the scope of the problem and its local impact are my guests, San Diego County Undersheriff Ed Prendergast and John Richardson, VP of Mental Health Systems, a nonprofit drug and alcohol rehab provider here in San Diego. And Ed, the Strike Force reports that in the last 5 years, meth death rates were up 93% between 2009 and 2013, and there were about 2,500 more meth-related arrests during that same time period. Why is meth use in our county on the rise?
Well, for a number of reasons. Demand is high. The price is low. You can buy an ounce of meth now for $400. So the combination of, and the meth users say it's very easy to get. Over 83% of them say it's easy to get, according to our survey that's reflected in the report card.
Do we know why it's cheaper?
Why it's cheaper is because it's coming in from Mexico, and we're getting large volumes, as you stated, coming in from Mexico, which has driven down the price.
And John, who, if you could tell us kind of a profile, who in San Diego County is using meth?
There is no really unique profile. Meth goes across all profiles, all demographics. It's from teenagers on through. We are finding, though, lately that the age of the meth users coming into treatment and being arrested is a little higher. It used to be around 25 to 30 years old on average, and we're looking at people up in the 30s and their 40s now on average. And a larger number of women are coming into treatment for meth use.
What kind of impact I'll start with you, John, does this have on our community, having an increase in this steady climb of meth users?
Well, I think the steady climb is because of, some meth users have been meth users for a long period of time, and now with the easy access, the meth use is up. And the impact on our communities and families, the children of the meth user, the spouse of the meth users, the employers of the meth users, the community as a whole, the criminal justice population that is involved in meth. If you live in an apartment complex and there's meth use going on, it affects the children, it affects the community as a whole.
Well, Ed, we were talking about this Mexico connection here. Now, 15 years ago, San Diego County was actually considered the meth capital of the country. That's changed because the DEA said in 2013 that they had no meth lab seizures here in the county. So that seems odd to me. Is this, I guess the drugs then, are they all coming from Mexico? Is this where we're getting it?
We're looking at about 80 to 90% of the methamphetamine consumed in the United States is coming from Mexico, and about 60 to 80% of that is coming through San Diego.
So is there something being done as far as the border agents or the feds doing something to try to stem that manufacturing or that flow from Mexico here into the U.S.?
Well, absolutely. I think the increase in the border seizures reflect on intelligence-led policing and cooperation between federal, state, and local agencies trying to stop it. In Mexico, in 2008, they banned the sale of pseudoephedrine and ephedrine, which help reduce the availability of that to be manufactured into methamphetamine. But the Mexican drug cartels are now using a different method to make the methamphetamine, and it's still coming across in large quantities.
And in fact, I understand in liquid quantities.
Yes, a percentage of it, about 13% of that seized last year, was in a liquid form.
Okay. John, what do you see as the answer to this as far as stemming the addiction of methamphetamine here on this side of the border?
On this side of the border, the answer is working together with law enforcement, the Health and Human Services Agency, and community-based organizations such as ours, and finding ways for people to find treatment and get into treatment, because treatment works for methamphetamine addiction, and recovery really does work for people, and doesn't just change their drug use, it changes their entire lifestyle.
What kind of treatment, if you could just give us a nutshell, is it different than, let's say, AA for alcoholics? Is it more intensive? What treatment works?
Well, the treatment for methamphetamine, it depends on where they're at, and most methamphetamine addicts are so tied into the methamphetamine lifestyle that they're either pre-contemplative or contemplative in their mindset as to that they have a problem or they need help. So working with law enforcement helps them understand that they need help and gets them to us, as well as working with people that are now in jail that are getting some treatment while they're in jail, and then hooking up with community-based organizations to get the treatment that not only deals with the drug is only a fifth of the quotient, to deal with their biological, their psychological, their social, and their spiritual malady, which is all a piece of the addiction. We have to deal with all of it. And so in treatment we do using motivational interviewing, using cognitive behavioral therapy, using socialization therapy.
Well, there's a lot more to talk about on that angle of it, so we'll have to end it there. John Richardson and Undersheriff Ed Prendergast, thank you so much.
Thank you for this opportunity. We do want to promote the Meth Strike Force, and we do have a website, no2meth.org, if people want more information.
All right, thank you.
Thank you very much.